So our vulnerable populations that we chose to focus on this semester include mobility, visual, and auditory impairment. So we will discuss the environmental and cultural factors which play a role. In the media, you'll most commonly see these individuals in an inspirational light, very well-intentioned, possibly even as a comic relief. There's multiple TV shows and movies which feature these individuals, but it's important to find that balance. Some media can come off as being insulting or alienating and can further worsen the inequalities experienced within these populations. Family support can make or break an impaired individual's health outcomes. These individuals will need physical and emotional support. Physical support being any kind of transportation needs within the home or outside of the home, getting from one place to another, as well as various caregiving needs such as completing their activities of daily living, making sure that they have adequate shelter and nutrition. Emotional support includes helping these individuals create a sense of self and feel independent, as well as taken care of and loved. Most peer-to-peer interactions are going to be supportive, encouraging, very helpful, and appreciative. But on the other hand, you will have some interactions that may be hurtful or cause some negative feelings between individuals. And within our research, we found that one of the biggest causes or the biggest reasons are misunderstandings of knowing how or when to help these individuals with the various impairments. Mobility, visual, and auditory impairments will typically not be cyclical in nature. They will most likely be limited to the individual experiencing the impairment along with just close family members or support, because they're just typically not passed on through genetics. There's a minority of cases where they are passed on due to inheriting the recessive genes or some sort of other fertility issue. Most disadvantages passed on to the next generation would be economically related and minimal based on the sensory or mobility limitations of the impaired parent. And so again, just typically won't be passed on from generation to generation. In the legal and political system, there are a lot of resources available, but there will always be holes in the system that could be better. Within all of these different groups, there's going to be different accommodations that they will need. So those with mobility impairment needing various assistive devices such as wheelchairs or wheelchair accessible buildings and various things of that sort. For auditory impairment, hearing aids, visual impairment, corrective lenses, and for all of these impairments, various health procedures that might be possible in order to help give them a better quality of life. These individuals may or may not be covered by insurance, so there's that socioeconomic barrier that is constantly looming over their heads. These assistive devices and procedures are very, very expensive, so that's a huge barrier. Interpreting services for these individuals it may or may not be available, as well as legal aid that these individuals may have access to. In a personal interview that was done by Adam from a really good friend, he said that there's many customizations of assistive devices that are covered by insurance, but most will need further adjustments in order to customize it a little bit more for the individual. And those adjustments typically will not be covered by insurance, and it will also void the warranty of the chair. So it just leads to bigger financial burdens for those individuals. For potential barriers, it was something that we had touched on a little bit earlier, but these individuals are more likely than not seen as needing more help than they actually do, or that they're unable to live independently. So this can be hurtful, or it can lead to greater distancing between individuals with these impairments and the general population. And it causes individuals with these impairments to not know how to ask for help or when to ask, as well as the general population as well. At an international scope, so in some third world countries, these impairments may be seen as the individual being cursed or damaged, which leads to abandonment, abuse, or possibly even being killed. Risk of abuse or mortality are higher if the disability is visible, especially with any type of physical deformity. But we were unable to find any direct evidence of deaf, blind, or mobility impaired people being in danger or actively shunned if these impairments were due to an accident or just advanced age. For socioeconomic status, so low education and low income status is linked to increased risk for multiple health disparities, which include the cardiovascular disease, obesity, diabetes. They have a higher risk of having poor health literacy or access to health information, and they have the inability to access basic needs, such as shelter, nutrition, opportunities for physical activity, and healthcare. Possible barriers as far as when it comes to access with physical activity would be public parks, trails, gyms, not being able to access those as often or as much as they would want. Emotional barriers in physical participation. Maybe they don't have the support from family or friends, or maybe it's just discouraging not having the right resources that they need in order to accomplish these tasks. Ethnic and racial minorities are subjected to less and limited access to healthcare, just at a baseline, which can exacerbate any health issues. And cultural perspectives may play a role in health outcomes, such as tobacco use linked to traditional ceremonies and beliefs. Religion shows to have positive and protective effects on health status and health behaviors. Those involved in any sort of religion are less likely to smoke tobacco or consume alcohol, more likely to be physically active, and report higher participation in health promotional activities. When it comes to gender, the research that we had found supported that both men and women with various impairments will earn less on average, are highly exposed to more workplace stress, and are likely to be less autonomous in their working conditions. And we also found research to support that women with disabilities are likely to not be included in conversations or issues related to any type of work-life balance. And all of these factors can add to the burden and challenges of family care, household needs, transportation, various disability-related concerns, and just building those relationships with your coworkers can lead to a decreased quality of life. For geographical location, some areas may lack adequate access to clinics, hospitals, urgent care centers, or other medical and health resources, or they may lack, again, the physical barriers that may be experienced, such as having transportation or interpreters. Telehealth and telemedicine are contributing to reducing the stress of having the lack of access. So that is a positive. For health disparities and biases. So an implicit bias, it is a feeling that you are unaware of subconsciously, which eventually turn into an action. So some of the biases that we had found are people with physical, visual, or auditory impairments live a very difficult life and are completely dependent on others around them. These individuals are less able than quote unquote normal people. People with these impairments are unsatisfied with life and their relationships. And explicit bias is going to be meaning that you're consciously aware of your feelings, and these feelings turn into action. So some of the explicit biases we found related to these populations include actively changing the way of your interaction or communication with those with these types of impairments. One thing that I see very commonly working in healthcare is, speaking louder and closer to people that have some sort of auditory impairment, which is definitely not something that you should do. Again, offering unrequested help to a person with physical, auditory, or visual impairments with the assumption that they need help, or just offering too much help. That's where that open line of communication comes in, and it's really important to discuss your intentions of where you're coming from, just wanting to help, but then also hearing their side of it, because they are the individuals living with these impairments, and they are very capable of telling you when and how they need help. And then another one is preventing opportunities to be given. And by this we mean, as for example, being in the workplace. People or individuals with these impairments may not be given opportunities that their other coworkers are, because their management or leadership team may feel as though that they are not capable, and that's not right to do either. At an international scope, these populations are largely unrecognized for public health attention, despite their growing numbers of individuals that are experiencing multiple chronic health conditions. And there's research to show that these chronic conditions are starting at a very early age compared to the rest of the general population. So there definitely needs to be more research and policy direction as far as addressing these health disparities for these particular populations. And these should include improved access to healthcare, increased health and human services capacity of workforce, routine collection of data for disability for decision making, as well as explicitly including this population in public health programs. And these are our references. So hopefully this provided a lot of helpful and good information regarding these populations. It's been really interesting to learn more about what we can do as nurses and healthcare individuals to promote a greater quality of life and greater access to healthcare.